the seats need to be increased. Quality of education needs to be maintained. There needs to be more transparency and stakeholder interaction. See, if this is not addressed, the patient quality will suffer. And as I said as earlier, they are the mainstay of our the treatments in the country. Just for example, to open a nursing college today in outside Bangalore is almost impossible. So I think these things should be addressed. We have to also ensure that sometimes my nursing colleagues disagree with me on this, but I think GNM course needs to come back, and we need to ensure that there are enough people to look after our patients. It's important that our nurses need to stay in India. They need to be able to have a good career. They need to be able to aspire for a good life. I think they do so much. So I think as citizens of a country, it is our due to make sure that all this happens. My commitment from AHPI, and I'm sure Raja will agree with me, is that we will continue lobbying for the betterment of our nurses. Because ultimately, for all of us, wherever we sit, the patient is the most important. So on this occasion, once again, on behalf of all of us, I want to wish all my nursing colleagues a very happy Nurses Day. I pray to God that He continues to bless each and every one of you as you bless so many others. Thank you so much.
Sir, I think thank you very much for your motivational welcome note to the late audience. So I think before we further, we have a crisp agenda for the day, and you are all aware that today we have Dr. Jothi Clara, who is one of the senior most member of the nursing team from Tamilnadu, Chennai, and I think Dr. Ajitha Nair. She's also from Kerala, and she's also been very known and very close to us. Privilege both of them here with us to address each and every one of the nurses, and it's a great opportunity for us to welcome both of them. So I take this opportunity on behalf of AHPI and Micheal to welcome them, and I request them to take us through today's agenda. So over to you, Dr. Jothi Clara.
Thank you, Microlabs and Mr. Rajan. And also I thank AHPI and Dr. Alex for that wonderful introduction. I'm so honored to be with Ajitha, one of the seasoned nursing leader, and she's not only a nursing leader, but a healthcare leader, I can say. I'm happy to be with her to deliver this particular session. We are not going to be presenting PowerPoints or just going to talk. We are having a different pattern of presentation today. So we thought that the theme of the Nurses Day is like nurses, a voice to lead. So we need a voice to lead. But what are we going to focus this year is invest in nursing and respect rights to secure global health. So rightful investment is our focus of discussion. Now, how are we going to invest and why are we going to invest? And what are some of the points we could take home back? And when we don't do rightful investment, what happens is either we will waste resources or we will not end up where we have to be. So this, after especially COVID and all the trauma that the world has undergone in India, all the hospitals have suffered a lot, people have suffered a lot. So we wanted to be very carefully putting in points so that there will be a thought process. When you go back, different sectors of people will understand what is the commitment that they have towards investing in nursing and what will be the benefit out of it. So we have a couple of questions and answers that will be between me and Ajitha that will go to and fro. And I think we will make the discussion very interesting. And we also want all the participants, like we have got around 35 participants link here, but I think there are more people connected as a group. So we want you to interact with us so that we'll make it more interactive and there will be some meaningful information that comes out of this discussion. So to start with, I would like to call in Ajitha to give her view. Like I have told, rightful investment is one keyword that I want to focus. What is one keyword that you want to give Ajitha for today's discussion?
I would say a rightful perception, Jothi, of everything what we talk. anyways, at the outset, let me wish all the nurses a very happy Nurses Day, and thank you AHPI and Microlabs for bringing both of us together on this occasion so that we can discuss on rightful investment. Well, I was talking about the rightful perception. So now, rightful, I mean, we react to any situation as we understand, right? So how well we understand a situation is how we are going to react. So when we talk about rightful investment in nurses and nursing, all of us look at it in different ways. The healthcare managers, the healthcare owners, the policy makers, the government, everyone, and nurses, they themselves, public at large, all of them look at investing in nursing in different ways, in their own ways. Now, I feel it's very important that all of us come to the same page in understanding what are the challenges we are facing and why we are facing those challenges and what's the way forward. So why I said right perception is, I meant right understanding and same understanding. Unless we are on the same page, what I felt so far is we do have some sort of investments. We can't say that we don't invest at all. After all, nurses are getting produced from various nursing colleges and schools in our country. And the nurses are joining the hospitals, whether they know nursing when they join or not. The hospitals are forced to invest in them, to train them so that they'll be able to take care of their patients without having much of problems. So everyone is investing. But since it is all not in the same direction or not in the same perspective, we end up wasting a lot of resources. In fact, what has been taught in the curriculum in the schools, we end up repeating it because what is being taught in the schools is not the way we want the nurses to know things or do things in our hospitals. So there is no alignment in our purpose, I feel, in investment in nursing so far in our country. So what I would urge upon everybody, all the stakeholders in public health, it includes the public as well, because if there is no nurse, healthcare cannot exist, as everyone agrees to it. But let's not limit it to the day of May 12th to accept all these things. The days in silos and their own ways, and that probably is that the barriers which we have to break in and bring everyone together in focusing on the rightful investment in nursing. Yeah,
so to add to Ajitha's point, so Ajitha very clearly told that perception is very important. Now, if you see in India, like how many of our parents or how many of the families would love to allow their kids to be in nursing? The first priority goes for medicine and engineering. So when will a day come? Like if you see in Western world, the preference goes to nursing in some of the countries, yes. And that is all depend on how nurses are treated, how they are taken care, and what is the position they are in when they come for a job. And people see that. When they see that, there is a perception. Now, myself and Ajitha, we were discussing what is that we could do more for school children. So for school children, how do we attract them? There are career guidances. So mostly when you ask a 8th standard student, a boy or a girl, they would say, I would like to become an engineer and a doctor. But then they would not say, I want to be a nurse. But I have seen some of them saying, we would like to be a nurse. Today, I had met one of the twin nurses. They are twins, but both of them are working. One is working in one of the critical care area. The other nurse is working in operations. So the twins, both of them came and joined. Then I was wondering, you're from a very good family and both of you are twins. Why did you come for nursing? Then he said, no, my relatives are there in Dubai and all of them are earning well. So my parents thought that we would be well positioned if we come for nursing. So this was a very different perspective for me today, and it was so related to the today's topic and discussion. Now, having said that, is this common? I don't think it is common. Now, how do we address it? How do we impact? How do we invest so that the future generation also prefers to become nurses? So any points on that, Ajitha? Would you like to throw some points on that? What are some of the strategies government can take, or probably as institution and leaders we could think?
just add to one point, Jothi, which you were making. The scene is very different in Kerala. In Kerala, if you ask in the schools or colleges, they would definitely say that they want to go for nursing, not because of anything else, mind you. All of us know the reason, because that is the only way to go abroad, relatively easier than the rest of the professions, right? So in Kerala, everyone wants to be a nurse. Well,
Ajitha, for a debate, I would like to differ. Then how come there are seats not filled in colleges and schools? So that is also
Kerala,
there in some part.
In Kerala, absolutely no seat is vacant this year.
Okay, but other part, there is a lesson learned from Kerala. You could share that.
Yes.
Right?
Yes. So in other parts, what happened is the nursing vacancies in schools and colleges are filled depending on the demand abroad. There is no doubt about it. If there is an increased demand abroad, there will be, all the seats will be filled. And why this year, I don't think any colleges has any vacancies being, and bulk, the nurses are going to mostly to UK and so many other countries, because everywhere there is a lot of vacancies created out of this pandemic. And this year everybody's seat is filled. So whether the seats are filled or not is the criteria. Are we having, Indian healthcare have enough nurses? The question is that. So if we want to have enough nurses, we will continue to produce nurses, but all of them, now they don't require experience either. So while joining nursing itself, they are preparing for IELTS or OET, and by 4th year, they have cleared that. Okay, so before clearing the nursing examination, they have cleared their IELTS and OET, and they just need a registration to fly abroad. They don't require experience anymore. And they'll go and have their adaptation and all that. Within few weeks, that's all over, and they start earning. So if we want to have enough nurses in our country for our healthcare, we need to definitely, as Dr. Alex said, need to have more production of nurses. And why don't we consider that as an opportunity? The government and the stakeholders in nursing, like the Nursing Council, which will become National Nurses and Midwives Commission soon. So the policy makers, including the universities, including the health directorate of each of the states, because all of them are stumble blocks today in having more schools and colleges of nursing. Of course, what they say is that we don't want to dilute the standard of education. All of us agree equally that we do not want to dilute the standards of education without diluting, rather it should be improved. But however, we need to have more seats and more people should come forward. So to answer to your question, Jothi, what should we do to attract more younger people into nursing? On a national perspective, different stakeholders should get onto public. We should, like how army attracts their people, we see advertisements being bombarded everywhere that, come to army, we will make your life and we will have a safe and secure and dignified life. So you talk about the positivities of joining the army. Ask me the positivities and the other side of being in the army. So it is not that there is no other side to it. There is, but then how do you showcase the employment opportunities? How do you showcase the progress you can make? Being a nurse is what should be focused while being, reaching out to the public and the youngsters. So there should be coordinated effort from the part of nurses themselves and also other healthcare bodies. And all those who are concerned about healthcare in this country should get into this exercise of attracting more young men and women into nursing. We can't exclude anyone in this, because first thing is to understand that, we are on the verge of a crisis, or maybe we are already into the crisis. Are we realizing it? I wonder. So, in a late realization probably will have more havoc. So it's time that we act on, and it is an urgency. It's a public health emergency that, all stakeholders come together to get more youngsters into nursing and create more seats and opportunities to become nurses.
Yeah, Ajitha, you're right. It reminds me of an history where at one point of time in America, when they had lesser number of nurses, they had used comics, they had used stories, and their stories and comics only will be on nursing, positivity of nursing. So when school children study right from 5th standard onwards, they will get inspired to become a nurse. So they also vouch that they want to become a nurse. So probably such campaigns have to be happening across. So that's a very nice point that you have put forth, Ajitha. Now, when we say investing in education, now you said, okay, students have come in and there are enough people. So what is the additional investment that we have to do on education? You said very clearly what is taught, like inside out teaching, like they have to be taught and they have to practice after 4 years. So they are trained today, or they are educated today to practice nursing next 4 years, after 4 years. So then what is the level that they have to be prepared? So after 4 years, what will be the healthcare? How will be the healthcare? What are the aspects that they have to know? How the hospitals are transforming every year. So these are some of the aspects I think has to be incorporated. Like we can have, like we have laboratories and virtual labs, and there are other skill labs in the colleges, but they should also have like a sim hospital. Like everybody is trained like an isolated ivory tower. So when they come on the first day, the nurse meets the doctor. We are expecting IPR, doctor-nurse relationship, perfectly well. But when they were in schools, they have not met each other even on a common projects. They have not done anything. So universities which has facility where they have colleges with medicine, nursing, they should try to hire, and other paramedicals, in fact, they can take a common healthcare case studies, and then they can practice together, so that at least then they will come to know how each of them interact with each other, so that they are able to have a better outcome among the patient. So do you have any other thoughts related to what is the investment that more we have to do from nursing education perspective, Ajitha?
Jothi, we need a paradigm shift, first of all, in the way nursing is being taught in this country. Now, when I say paradigm shift, is today's nursing education, be it the GNM curriculum or it's the baccalaureate curriculum, it is more focusing on theoretical classes and relatively less on practical aspects, and for long years. So an overhaul of all these academic curriculum into, learning the essential things, allowing them to choose some specialities in the middle of the course by, say, second year or so. So in 2 years, you can teach whatever is essential in nursing. In fact, all subjects can be taught in that time, and let them focus on their choice of specialty after 2 years, 2.5 years, and practice in that respective area, so that at the end of 4 years, you have a patient ready nurse, a hospital ready nurse, unlike in today's practice, where when they come, they are so bewildered as to, they don't know what to do. They do not know to do any procedure, right from taking vital signs, or they don't know to take temperature, because they have been using mercury thermometer in their school, which none of us in many of the hospitals follow today. So they have what they have trained, they painfully realize that, half of it or more than half of it were wasteful learning, practically of no use to a nurse. So, we should completely discard those things which are no more used in hospitals, those outdated practices. Because of this divide that, the curriculum makers in nursing, do not come to the hospital. They do not know what is happening, most of them. And we will have to have that some level of integration as to who controls the curriculum and is it relevant to today's healthcare. So this unnecessary, I mean, it is so painful to see that, they learn a lot of things which they will never be able to use in their practice. So we will have to overhaul the curriculum, is what I feel, to make them fit for today's healthcare delivery. So that making it relevant is very important, and it requires participation from a lot of stakeholders, and do they understand this, I wonder. So it's very important that we focus on these aspects. And also, second point, what you said, this interprofessional education, some of these topics are same for everybody. See, anatomy of knee joint, whomever you teach will be the same, right? Whether a physiotherapy student or a nursing student or a medical student.
Applied anatomy physiology.
anatomy of any part of the body will remain the same. Then why are we having so much difference in this education? And maybe focus would be same, but I'm sure 50% of the lessons can be the same. They can be taught in the same kind of classroom, whereby you will be saving a lot of teachers. Like there is already dearth of teachers, and if you can make changes where some kind of an integration part of the training can take place, that will save a lot of resources in the already resource crunch academic programs. So the key point is that we do not have adequate discussion taking place on these aspects when it comes to training. Okay, so we all love to work in silos. So the educators have hardly any contact with the hospital. They'll send the nurses for training to the hospital, and maybe one or two smallest or youngest teachers accompany them who do not know themselves what is the practice in the hospital, and they'll come and onlookers and they go off. I mean, these kind of training has to stop, and whereby teachers have to take more interest in learning the practice, and also those leaders in nursing practice have to take more interest in understanding what is academic curriculum. And we have to come to a merging point where we should be beneficial to each other and not working in silos. They produce graduate nurses and give them to the hospital, whereby the hospital realizes, hey, these nurses don't know anything, and you will have to start all over again. And we pack that learning into 10 days, 15 days. Earlier it used to be 3 months. Now we in 10, 12 days, we pack all these things, and such overload for them. And poor young nurses, I tell you, it is such a pathetic situation to see them struggling between these. And then they are put at the bedside. Okay, so for some time there will be a preceptor or a mentor in some private hospitals. Some of them are just thrown at the bedside. And it is like putting them in water, those who don't know to swim, and they somehow, those who have survival skills will learn. I mean, it's such a sorry state of affairs, and we are dealing with human lives. And you see how actually the practical reality of nursing practice today. So isn't it time that we all sit together and bring in some changes? I mean, I don't have any magic potion to tell, in fact, to suggest what can make that change which we all are looking forward to see. But I feel all of us will have to put our brain together and have more discussions, debates, and interactions, whereby all these curriculum makers will be moved to make these changes. Yes. Or I don't know whether they should become patients. I don't know. I wonder this.
You're right, Ajitha. Actually, when we see what Ajitha says is right, because there are certain things that can only go in the museum, which cannot be used in practical life, because those are not even seen in the day-to-day practice for the nurses. So we can have a museum to let know the history of nursing, and these are being things used. But what is currently used should be known to them, the equipment, the supplies, and whatever it is. And also breaking tradition should be a theme. Like basics are very important, but breaking tradition is very, very important, because when we break tradition, we come to know reality, objective, what is that we want exactly to deliver to the people, to prepare them as a product which will be absorbed immediately, and they should be current. After 4 years, they have to be current. Now, when the nurses come to practice at the service side, greater thing is there is disparity between the, okay, numbers are not sufficient, and to add to it, like fuel to the fire, the capacity, the competency also is a great challenge. So building competency from level 1 to level 3 is becoming a greater challenge for the clinical perspective people as well. And on the other hand, we are investing a lot in training, which is very subtle investment that goes in every hospital. Imagine the kind of training they have, the educators and others, they spend time, they take around 3 to 6 months, and then to become a full-fledged nurse, it will take almost a year for some of the nurses. So in this case, like certain things have to be invested from the service immediately in the education front. But what can best suit the hospital front strategies that can help nurses to go better? See, now we have interns coming into hospital. They are the best catches for us. So probably during internship, they are all the colleges, they let the interns in the hands of nursing service, and they are posted in the hospital. So that is the greater low-lying fruit for us, I think. And there we have to really bet upon and prepare the nurses so that within 3 months at least they are job ready by understanding, by knowledge. And competency wise, to some extent, they are prepared. The fear is gone, the understanding is more. So they are, at least the capacity is enhanced. So what is your thought about it, Ajitha, on that? And also, we have to speak something on the workplace and the work environment. What is that we need to do so that such young nurses, when they come in, they have to be nourished, they have to be grown. Many times what happens, they run away. Say at least they change 2-3 hospitals before they get rooted. And right climate is very important for such nurses. It's not their fault. They have been prepared and they are coming here. Some are lucky enough to learn. They get better environment to learn, better instructors to learn, better hospitals to practice by observation. But then there are others who don't have the luck enough. So such candidates, when they come, they have a talent. I have seen a very poor, competent nurse. When they enter into the hospital, they turn out to become an extraordinary nurse in probably few years. How it is possible? And many question comes to my mind. Some of the nurses who travel abroad, they would have been an average nurse here with us, but when they go abroad, they have career path. And suddenly, maybe after a few years, we see them hitting some projects, they get some awards. It's amazing when we see that. So then talent is there. Somewhere it is hidden. So tapping the talent is another challenge. So these are some of the things that probably from the healthcare perspectives, the CNOs and the nursing director, nurse educator could have an insight. So you could throw some aspect of this.
Jothi, the environment which they are subjected to, when they come to the hospital, we are talking younger nurses. There is something known as reality shock syndrome. Whatever they have imagined so far about nursing care is not nursing care when they come to the hospital, right? So they have been, put through such, test of fire when they come to, the hospital. So the responsibility of the hospital is probably catching them little younger, not at the time when they graduate and come. Before that, we have opportunity when they come for clinicals in most of the hospitals. So wherever that is there, they should, the service people should take more initiative to orient them to what is the reality before they become a full-fledged nurse. So if the situation is familiarized, you are saving on valuable time, and this reality shock, for some time their brain just stops working. So and getting over it is a trauma, in fact. So if we can get over it by involving the service people into training, because today's rigid rules of the nursing council as well as the university and the medical education department does not permit. The rules are very strict. You need to be postgraduate, you need to have teaching experience, you need to have this and that. And when these young nurses are thrown at the bedside, all these are not applicable. That is very surprising, right? When they are coming to the bedside, when they are dealing with real human lives without having adequate competence, where are all these rule makers? Because their rules are applicable only for training, and once the degrees are distributed, their role ends. I mean, that's so paradoxical. That is, absolutely not acceptable, right? When they are having a real patient in front of them, who are going to teach them are the diploma nurses who have experience at the bedside, who are there in the ward. But then they are not allowed to teach them while they are being a student. So, we should get away with all these kind of, very rigid rules. Rather, the education sector should become a little more practical and, infusing them the rightful learning. So that is one way of looking at it. And while being in the hospital as well, each hospital should take responsibility for building up their, requirements, because ready-made manpower for any super specialty, be it operation theater, be it your cardiac nursing or critical care nursing or maternity or anything, is not available. So all of us have developed our own ways of preparing them for the hospital when they come young. Now the challenge is right now what the challenge we face, these nurses come young, but then 5 months, 6 months, they are gone. Okay, so we are caught. So earlier what we were doing a couple of years back was catch them young. You are sure that 2 years they will stay with you, because because the abroad jobs required job experience of 2 to 3 years, and now since that is quashed, there is where we are caught as of now. Yeah, I was just taking a stock on the situation, because we had a nurses day program here. So in the hospital, I am right now sitting at Kim's Hospital in Trivandrum. So I was just looking at the statistics of this place. We have about 850 nurses, and out of them, the ones who have completed 2 years are only 200. No, not even 200, 180 something. Okay, so the rest of them are less than 2 years in this organization. You can imagine how much of nurses have gone out and have come in. That's one aspect of it. And second is so appalling that from January till now there are close to 200 nurses who have already left from this place. And I am sure every hospital in this country, barring maybe some Mumbai hospitals, in Maharashtra, I believe attrition is a bit less. And this is a problem in metro hospitals. Maybe in level 2, 3 and villages, this would be less, because those were only work there as nurses there. So but the bulk of healthcare, the tertiary and quaternary healthcare happens in cities, right? And in all cities where the highest level of intensity of care happens, this is the situation. I mean, we are caught in a paradox, and it's high time we understand this. Okay, so it is so urgent that we do something to improve capacity building, and we do talk about it quite often. Not that nobody does anything, but unfortunately, whatever we do become, as each day passes, so little against the requirement, against the challenge we face. It's not that nobody does anything, that's not the case, but whatever we do has become so little as in comparison with the requirement, or as in comparison with the challenges we face. So where we have to augment, and to what extent even augment investing in nursing. So there comes the word rightful investment. Rightful, I have, practically I don't have one word answer, Jothi. So it is imperative that all of us sit together and come to a conclusion. And I'm sure there is one stopgap solution just does not exist there. A combination of different methods and based on the requirements from place to place is what we have to put in. But however, unless and until we discuss and talk about it and bring in changes, the situation is going to be very, very difficult for us.
Yeah, I understand, Ajitha. Ajitha says that it should be a strategic decision which comes top down, and all of us have to agree together. So it should be a national call for this change. And this agenda should become a national agenda. Retention of nurses in India should become a national agenda where everybody puts their hand together, statutory level, institution level. It has to happen. Otherwise, we will not be able to have retention of, we lose talent. We lose talent. And in India, if you see, like majority of the surgeries that are happening, see, because I'm in the international organization, we could compare. When we compare even with other organizations internationally, the benchmarks, we are better than in benchmark compared to those. Like, for example, liver transplant or another thing. I think many of our hospitals are that way. We are able to have a clinical outcome beyond the benchmark that is there in the international level. So it is all possible only because of the talented nurses. To their hands, all the handicraft of the doctors are going into. And they are making the outcome, contributing 50-50 along with the clinicians. So this is an amazing thing we have to retain. So it should become a national agenda that nurses retention is a must. And replacement of nurses with low-cost substitutes will not make a difference. It is not going to make a difference at all. Nurses retention and replacement of nurses for the nurse is the one that we have to think for. Of course, skill mix is can be incorporated. So, Ajitha, with this, I thought there is a great challenge for nursing leaders. If you ask all the nursing leaders, CNOs, they are actually on hot seat. One side, we have the balance scorecard, retention of nurses, your attrition rate should be this much, but the reality is not that. And all the CNOs and the nursing heads are struggling to their best to even extend. See, if you see in our organization, the average length of stay of the bedside nurses is 1.8 months. 18 months, sorry, 18 months. If it is 18 months, what can we do? They are just passing away. It's not that they don't like us. They are going for better opportunity. We cannot give that much what they are given outside or abroad. And what are the perspectives they have outside when they go? The quality of life and the lifestyle and the family raises to a different level. But it is not possible for us to do that. So they are moving. So we have to say handshake and say bye, and then with a cordiality we go. They come back maybe after 3 months or 3 years or 5 years. Sometimes they don't come back also. But I'm not talking about all that. All that I'm talking about is how to retain talent. When we are able to retain talented surgeons, talented physicians, talented other healthcare professionals, why there is a challenge to retain nurses alone? So I think it should become a national agenda. So this is a point that we want to place here to all of you to maybe reflect, and if you can even put it in your chat box if you feel like sharing with us. Now, Ajitha, would you like to talk something on behalf of perception about nursing leaders in India? Like, what more we have to invest? Do we have enough nursing leaders who are able to be in par with medical fraternity, supporting the facility head or the CEOs to run the hospital? Mostly they are only doing the job, but sometimes it's like a parent relationship they have with nurses. But we have to see nurses with leadership quality. Only when they are leadership quality, they are able to differ points, they are able to disrupt, they are able to bring in innovation, change, and they are able to stand strong and tall in the organization. So do you think we have a good number of leaders available in India? What will be the future?
Jothi, I don't know whether telling truth would be a crime right now.
It's a discussion. Nothing is right and wrong, Ajitha.
As it stands today, the future of nursing leadership, I wouldn't say it is absolutely hopeless, but then I'm not too hopeful either. Because this was one of the challenges we all faced, that, and we took it on our stride to develop more leaders, and we invested so much of our personal time and effort on bringing up the younger nurses. But unfortunately, we could not, and we must admit the fact that we could not probably place them rightly, or they were not comfortable in where they were, be it because of their salaries, and I could manage good salaries for some of them, but then the environment of working was absolutely unacceptable for them, that they left for lesser positions in Canada and UK. Those who were occupying, I mean, even those who were nurse leaders, nursing superintendents, they are going there and working as staff nurses. I am not saying that is bad, that is good only. But then, if somebody who enjoyed, or somebody, they are not able to enjoy, that's why they went off, right? They were struggling being nurse leaders, because whether be it retention, be it competence, be it clinical outcomes, what we end up doing is a blame game. The nursing head is squarely blamed for nurses being not retained in an organization. And we also have to take accountability. I wouldn't say that they are not accountable, but it is a combined accountability. We will have to reach up to a level where we own all these things together. So it is there is no role of blame game here, because blame game becomes too difficult to handle at times. I know a lot of nursing heads who have put in their papers and sitting at home. I know them personally, I'm saying, it is because that much more pressure. So it is time for the hospital owners. I am talking about the private sector. Okay, government sector is neither better. Okay, because I worked 15 years in government sector. Okay, so that is neither better. So for all the woes in nursing, if you blame the nurse leaders, they will get fed up, and they'll put rest to their career and sit at home. Not happily, but then many of them are saying that, oh, what a headache. Or you ask anybody who is retiring, oh, what a peace, when you retire. So it has become such a painful job rather than being a nurse leader or heading a nursing department, because of all these things. So nurses at the other side have got a sort of problem which I call accountability phobia. I do find that nurses are lagging behind in taking accountability and responsibility, and they've been trained that way, I wonder, or some congenital anomaly in the entire nursing force where they love to stand behind someone. When you are asked to do something, or when you are asking something in a group, even, there are hardly any nursing voice comes in. So we, the nursing leaders, have to put in our thoughts together to make them responsive if a situation comes. So instead of just mechanically working, they have better brains, they are at the bedside, they have better ideas, they can give us more solutions which are practical, but their thought process somewhere is blocked. So there is something in the hospitals, especially in private hospitals. Government is a little more better, because they have uniform rules, and the rules are same for everyone. So that's a better place, I would say, as far as the comfort of a nurse is concerned. But in private sector, it is absolutely unacceptable where nurses are pushed to a corner. So you can say, exceptions. I wouldn't say that one and all places are same, but we are talking about the majority of the hospitals where today's doctors wants only handmaidens. They just want their orders to be followed and nothing beyond it. And sometimes I really feel that they do not want a thinking nurse at the bedside. The moment you ask a question, all equations go bad. Just even if you remind that the antibiotic day is over, or the patient still has symptom, and maybe you can try another antibiotic, they don't like it, and they end up asking, so many years we had been practicing medicine, and who are you to question us? So this kind of monopoly, and it is high time. But if you don't realize it today, I'm telling you that day is not far where they really realize it in a bad way, where you don't have the nurses with you to run the hospital. So and when you talk one-to-one, most of the doctors accept this and they are willing to change. But I do not find a nationwide change happening. So maybe that, Jothi, I can suggest is that we work hand in hand with organizations like IMA or medical bodies. It is time that we reach out to them rather than we waiting for them to come to us.
Yes.
Because we have realized that there is an impending crisis. So we put our egos aside, and even if we have to go to them to make them realize that, hey, there is an impending crisis which is going to affect all of us together. Yeah, that wouldn't be a bad proposition to take a first step, I feel.
Fantastic, Ajitha. That was a great point that you have discussed. So far, like, we have brought in very important points, like 5 important points we have discussed. First is breaking tradition. Very, very important. So unless we break tradition, we will not be able to lean waste, or we will not be able to bring in efficiency and progress forward. Second one is retention of nurses, not only nurses, nursing leaders. It's a great agenda. And this should be a national agenda, and it has to be taken properly from the statutory level down up. It has to be pushed so that it becomes everybody's business. It's just not the nursing leaders.
Yes.
The third point that we actually discussed here is labor is plenty, and harvest is plenty, laborers are very less. So how do we promote? So there comes our innovation strategies, and it should become say that nursing profession is no way lesser to any other profession. That's the most trusted profession. COVID has taught us, but post-COVID, again, how long people will realize, how long they'll follow that, we are not sure. But today, Nurses Day, we could see people praising, talking about nurses, but it should be 365 days, just not the red carpet only on the 12th. Then, as you rightly said, thinking nurses. People should invite thinking nurses, not just the angels is not enough. We have to become intelligent angels, and they have to be a thinking nurses. So thinking nurses, we should be promoted. And here we have to bring in disruption. So disruption, and we have to bring democracy in that. And as you said, association coming together, like very nice point you had put at the end, like we have to be associated with medical councils or associations of medical forum, and so many other things are there. So let us join hands so that we can say, I think AHPI is on a very good platform who can help, where when it is a nursing domain, we want nurses to be there. Although we don't have enough leaders, but we have leaders who can think, who can contribute for national level growth related to nursing. So keeping nursing to deal with agendas pertaining to nursing is another very important aspect. There should not be any decisions or there should not be any agenda that is coming to the table without a nurse spreading herself on the table. So then this will be a greater outcome and give visibility for nurses. And every decision in the hospital, the nursing leader should be involved. Many places, what do? They build the hospital, give the nurses station. The nurses are the best architect, I would say. If you call a nurse in the critical care area, ask her, how should a nurse's station be? How should a critical ward should be? She'll be the right person to tell. She's a beautiful architect. But many times they are not in the committee even to design hospital. Hospitals are designed and then finally a building is given to them for running the particular ward or an ICU. So these are some of the points I think we have placed for the audience to think, reflect. See, we are not bad. We are growing from strength to strength, but all these points will help us to move forward to make a better nursing tomorrow, and we will be more visible and more trusted. And we will, the entire community, we are only focusing on the patients, will not suffer. And the last point I would like to touch upon, and Ajitha will close the note with that point. Nurses play a role on, see, our model of care is different from medical model of care. We more focus on preventive model, and we always focus on not a disease model. So we wanted to have the patient safe wherever they are, whether at home or in the hospital. So predictive model is being more appreciated by nurses, and we follow the preventive aspect of care. So this is another major area which is untouched by the nurses, and I think the healthcare system should explore on this further, especially in private institutions. All these are very important for us to think through and take forward. The last point, again, this point Ajitha will cover in her closing note. Another point which Ajitha will cover also is related to investment on nursing leaders, like bringing in a good management training program, exclusive clinical leadership, exclusive programs on clinical leadership for nurses, where they are able to have their credentials strong so that they are able to deliver better as leaders in healthcare. And also in that, there will be aspects related to fiscal management, aspect related to various related like CEO related talents can be incorporated so that they will be a better supporter for the management and the leader to whom they are reporting to. So over to Ajitha to close the session with the closing note. Thank you, Ajitha. It was very interesting being with you.
Thank you, Jothi. Before we close, is there any questions from the audience I would like to ask, and maybe someone can put us through the questions if any. And is there any questions, Mr. Raja? Vijay?
Vijay, is there any questions from the chat box?
Yeah, some Dr. at VNC Santhya.
Brigadier Santhya, tell me.
She has raised the.
She wants to contribute.
Yeah, I'm waiting.
Or you can just read out the questions too if you have got the questions.
Yeah.
You're not able to see the question.
Yeah. Okay, we can put in the chat box in the meantime. You know what Jothi was telling about building the clinical proficiency of. In today's scenario in our country, what we find, little bit different from the Western world is that we do not have a clinical stream where career progression can be ensured for nurses. I can assure you, had there been one clinical nurse who can become a leader at par with what happens in the West, I would have never thought of coming into administration, because administration is such a painful thing, a thankless thing to do, as opposite to what you do at the bedside for a patient. And we do have excellent nurses at the clinical area. I remember having a nurse who who was a counselor in bone marrow transplant, and she was my deputy too. And patients used to come to that particular hospital only because of her counseling. That oncologist was going to different hospitals. In that particular place, we had a model where doctors practice in different hospitals, and all those patients who came to the hospital came because this nurse made a difference in their understanding, in their experience going through this process of bone marrow transplantation. And we need more nurses like that, and those who have, and unfortunately even that nurse is sitting in Canada today. Every one of them being the leaders, they had to leave the country and go. And unfortunate that we have not realized the clinical potential of nurses. Unless we change our way of looking at them as just handmaidens to do a few sophisticated nursing procedures, from there, understanding a human being, making their walk through a difficult situation of a healthcare issue easier. Nurses have the tremendous potential for that. So unless we recognize, reward, and make their life comfortable, we will lose such nurses. And all those people whom we have invested in spending our time are not there today. So sometime I feel that, our generation of nurses, did we go somewhere wrong? I was talking to so many leaders, and all of us share this feeling that did we all go somewhere wrong in retaining these people, or did we not canvas them enough, or made the management aware of it enough? We end up thinking like this, where when we lose such nurses, and that is a tremendous loss, because they are not going to come back. All these nurses who left will not come back, and that is a national loss. And unless and until we bring in this clinical ladder or a clinical stream up, we will not be able to retain clinically proficient nurses. We should not be building up our healthcare depending on those nurses who have no choice to go abroad. Today, many of the healthcare systems are run depending on such nurses who have no way to go abroad. Hence, the hospital is sitting pretty on them, depending on them, not by recognizing them and adequately rewarding them. This scene has to change. And to answer where the money comes from, all of us will have to sit together and think. Today, if at all some healthcare, some hospitals make profit, a large chunk of it go to some few doctors, and of course, owner of the hospital, and if at all there is a profit made. Most of the hospitals do not make profit, by the way. Many of the hospitals are into losses. So what I would urge the nurses also, or we nurse leaders, we have to teach our youngsters is to learn numbers, where the money goes or where the money drains, or, how to control the bottom line, how to make it at least viable. One of the objective of my company is to help a hospital to be sustainable. You know that in today's world, a lot of the private hospitals are being sold off to other people because they are not able to run the hospital. They are getting into losses, tremendous losses, where they are not able to recover from. So the hospitals are facing such existential crisis, and it is time that nurses contribute more to sustainability of the hospital. So this in itself is a different topic altogether. So maybe nurses will find their rightful place if you little bit are willing to change the way we ourselves look at nursing. So I want to end by, we have touched on so many different topics. There is no one shortcut answer for any of these problems. What we understand, the more we discuss, we only understand how much more we need to discuss to find solutions for these issues and problems. And I would like to take this opportunity to thank Microlab and AHPI for such a wonderful opportunity. It was such a lovely thing to talk to, being in a discussion with you, Jothi, and such a pleasure. And I cannot find any questions right now here at all. So maybe for closing, over to Vijay.
Yes. Yeah, in fact,
Happy Nurses Day to all nurses. Ajitha, Happy Nurses Day, Ajitha, to you.
Thank you to you too.
I think, ma'am, it's been a very nice the panel discussion we have had today. In fact, we being in industry, so it has been a kind of shocking truth for us to see the kind of the pain that every nurses undergo in the hospital. And although most of the pharma companies today are adding value to the healthcare industry, but largely pertaining to in the front of doctors. But I think microlabs have understood the nurses who plays a very, very vital link between the healthcare industry, between the doctors and the patient community at large. So I think that our association with the nursing community will more and more increase day by day. And I'm sure wherever the pain areas are there for a nurse, I think we will try to bridge in and see that whatever the best support we can do from the industry in terms of now adding the representation to the concerned bodies to improve the awareness about the situation, and as well as to improve the value addition to the nurse as a professional. I think we should be so we will show all the solidarity that is possible from our end, so that we can certainly add some value from the industry perspective also. I think that's something that as a commitment we would take as an industry from our end. I think coming to my thank you note, nurses certainly play a very key role in our society today, and we remember every noble act on this special day. There's no doubt about it now. In fact, thank you just doesn't seem enough for all that you do, not only during this difficult time, but also in your regular day-to-day work life. So I think I still remember, like during the COVID time, even our Honorable Prime Minister, Mr. Narendra Modi, when the COVID was at its peak, the first call that he had actually had the opportunity to interact with the nurse, and that's how he showed the kind of the inspiration what he could add to the value of the entire healthcare industry. And that's where probably the leaders today in the country are looking at the value chain, what nurses are really adding to the entire community. And I think all this, it's only a matter of some time that we can certainly
I think got disconnected now.
Yeah, I'm back online. I think there's some call I just got missed out. Can you hear me, Vijay? Hello.
Yeah, yeah, we can hear you.
Yeah, sorry. As the saying goes, I think you have the nurses have the hands that turn caring into action. They have the touch that turns compassion into comfort, and they have the smiles that turn love into healing. So this is truly the art of nursing. And one step ahead, the way Captain Ajitha ma'am has clearly pointed out, it's now high time that from the art of nursing, they need to also go into the part of sustainability, and also adding value to the overall hospital industry, which can also help them to recognize their presence in terms of the hospital. So I think it's a great pleasure to have today both Dr. Jothi, Clara, Micheal, who is the Director of Nursing and the Vice President of ANEI Chennai, as well as Captain Ajitha Nair, who also is a Managing Director of Healbiz Healthcare Management Solution and the Treasurer of ANEI. I think, ma'am, both of you have really helped us to go through the need for the theme of the financial year, invest in nursing for country's health. And as I've already narrated, I think both microlabs and AHPI will always be glad to offer the best of support to our Nightingales in these challenging times. So we salute all your services for the humanity, and we also pray for your well-being of you and your family. So once again, I thank you, one and all of you, for your attending today's session, and happy Nurses Day once again. Thank you, ma'am.
Thank you.
Thank you.